Hi, I'm Dr. Matthew Norton, founder of People Plus Purpose, and your host on this episode of the Truth Behind Dentistry podcast. And today, I am excited to be joined by dental executive business coach Liz Lord. Liz is also the president and COO of TMD and Sleep Solutions, which is a clinical and business training academy that teaches dentists to simplify TMD and sleep so they can incorporate it into their practices quickly, predictably, and profitably. Welcome to the podcast, Liz.
Well, thank you for having me.
Absolutely. It's my pleasure. I've been looking forward to this conversation and it mostly so that you and I could be together, but also I wanted a chance to get back into the woods with you as well. As we had talked about this background that you have the previous time we spoke, right? So it is a pleasant background to look at, and so I appreciate that. So
great, I'm looking forward to it.
Yeah, so you've had some diverse kind of career experiences, right? A bit of a journey to get to what you're doing now. And so I think this current contribution has to have been informed by all of these different experiences that have brought you up to this point. So maybe we can start by just having you give a brief overview of some of those key stepping stones that brought you to what you're doing now.
Oh, sure. I started in dentistry back in the late 80s, and I was a clinical person for the first 12 years, an assistant, and I went to hygiene school, but unfortunately I never got to practice clinically in hygiene because the back injury took me out. So I went over to business school because I was always intrigued by business too, and worked in the business office of a dental practice, and then a few years later went into coaching dental practices, which is what I've been doing primarily for the last 20 years now. And there's so much that you learn, especially from the executive execution of what does it really take to not just run the day-to-day operations of a dental practice, but to be successful as a dental business owner. And that's just been a phenomenal journey. And I was really fortunate about a dozen years ago to work with a client who had done a lot of work in the TMD, TMJ area. And he really educated me so much on it because, having the background in clinical, I knew that was kind of like a Pandora's box. And the opinion of most dentists was really just don't go there because you can't help these patients. It's just going to be fruitless and painful for everybody. And when I worked with my client, he actually was able to really break it down and have it make sense. And fast forward about 5 years ago, I met Dr. Dorothy Kassab out of upstate New York, who's spent the last 20 years really delving into this area. She's done a ton of continuing education, but she went further and started researching TMD because one of the concepts that's out there and has been out there is that it's very complicated. And if you ask her, she'll tell you, I've tried all the complicated stuff with all the instruments and everything else. And it was so complicated that she decided to continue to research. And she found a lot of information in various places and has put together this incredible program that I've been through, I've had clients go through, and it simplifies TMD. Instead of trying to manipulate the body, working with the body's physiology to get patients out of pain, and identify a lot of people who have symptoms that they show up in a dental office for, or sometimes they show up in the ER or another health professional. And if they do show up in the dentist's office, a lot of times it's those patients where it's like, I really can't find what's going on here. They're complaining of this in this area, but I'm not seeing anything. And a lot of times what's really going on is with the TMJ. Patients are winding up in ERs and getting all these tests done, EKGs and MRIs and CTs and blood work and missing time from work, only to be told, well, we can tell you what it's not, but we don't know what's going on.
Yeah.
And quite often, a lot of these patients, it is directly related to what is happening in their TMJ. And so she created a program that simplified it with lots of checks and balances along the way, and she gets people out of pain and has a tremendously high success rate. And at the same time, is able to deal with people who have constricted airways and aren't, are snoring, not able to breathe well, dealing with sleep apnea, because a lot of sleep apnea kind of falls out of TMJ. Like when you handle the TMJ, you handle both. And not to say she doesn't handle people who are just sleep, but a lot of times it's correlated together. So it's so exciting to be partnering with her to really change the conversation in dentistry about what is TMD, how to treat it, and how to really help patients that so often are not able to get the help and just suffer. And that to me is heartbreaking. And I really want to have an impact on that.
Okay, that's good. I was going to ask you kind of what the inspiration was. I mean, you kind of had this fortuitous meeting and exposure, but it sounds like what's inspiring you is that it has been something that's been difficult to resolve or is not being really addressed on a regular basis because of that, either a lack of awareness, lack of knowledge, or lack of tools, maybe in skill sets to be able to do something about it. But it's kind of captured your attention, I guess, because of those things and seeing an opportunity maybe to make a difference. Is that what you'd say?
It's a little bit of all of that. And, I suffer from it myself. And the truth is, I didn't even know that I did. I get every now and again, I get a little ringing in my ears going on. And I'm a public speaker, and I have been for 20 years. Well, over the last 10 years, when I spend a good amount of time speaking, my jaw is so sore afterwards. So, I kind of found out I had it and have been getting treated for it, but it's extraordinary. I'm a clinical person at heart. So for me, helping patients is what it's really all about. And when you can help somebody who has been to every doctor you can possibly imagine, every ologist, psychologist, all of them, and nobody's really able to help them, and you can help them, that to me, that's why you do what you do.
Yeah, I love that. I think that's a really right foundational reason anyway, right? So
yeah.
So for those people who are listening then and thinking, okay, maybe I've had interest. This sounds appealing to me. I don't know exactly what next steps might be, but I'm wondering, even from a business perspective, like if I'm not there doing these things now, what are some of the concerns, like say, I guess from a billing perspective, from the financial piece of how do you work that into a practice, and what are some of the elements to be concerned about maybe, or that you could help those watching kind of resolve whatever hurdles there might be that would be keeping them from stepping into this further? What would that be?
Well, you dove right into the deep end of the pool with billing.
Yeah. I mean, it does come back to business a lot of times too. Even if I have a heart for it, like, how am I going to do this? How would I do it?
Yeah, exactly. Well, because you really actually are hitting the nail on the head, because a lot of times doctors will go and they'll get clinical training and they're so excited about it. And then how do you implement it in the practice? And it falls on deaf ears, because their team doesn't know, and if the doctor doesn't really know, they never really get to take all that clinical excellence and have it make a real impact.
Right.
So for us, one of the things that was really important, and the reason Dr. Kassab wanted to partner with me, is because bringing things into the practice is exactly what I do. How do you create the systems so that you're able to implement all that fabulous learning? So and I've been doing that for 20 years. So creating the systems. We have it all the workflows and everything mapped right out. We work with the team to train the team. We work with the doctor to train the doctor on the business side of it, because TMD is really highly profitable when you're implementing it correctly, because such a high percentage of people have some form of TMD, similar to the prevalence of periodontal disease out in society. So there's quite a bit of it out there. Also, in the realm of TMD, you can cross over into medical billing as well. Now, a lot of dentists like the idea of medical billing, in that, hey, it's another resource, because dental does not really reimburse well, and certainly not for TMD. However, there's a big headache factor that comes with medical billing, because it's really an entirely different language that they need to learn. So medical billing is a second language, basically. And so being able to teach the practices how to speak that language, to teach the doctors even how to write their notes up so that the language translates into being something that's qualified to bill to medical, it is a critical component of it. And then, fortunately, Dr. Kasab also does have a billing agency, so she's able to help the offices that really don't want to deal with the billing of it. One of our key things is, a lot of times it's simpler and easier for the dental practice to treat it as a fee-for-service procedure and allow the patient to bill their medical insurance, but provide them the documentation so that they can get reimbursed, and to know the steps along the way so that they don't mess that up for their patient. So we try to make it as simple. Everything we want to do is we want to keep it simple, because there's enough complications in running a dental practice. We don't need to add any. We want to simplify it, being able to help your patients, being able to get paid well, and to help your patients make it affordable.
So you've kind of taken away some of the billing complexity, or that barrier, I guess, that would keep people out. And you're saying that it really is, not only is it needed, but it is a viable business avenue for a practice to take. Maybe a couple other thoughts on that. Why else do you think it would be meaningful, valuable for a doctor then to a dentist to step into this service offering, and then maybe also lead into how do you segue that? How do you recommend the doctors begin to be able to broach this topic and this concern in the process of their regular care?
Yeah, so why is it viable? Well, first of all, a doctor can simply look at how many occlusal guards are they doing in a year. Now, if they're doing occlusal guards, there's a reason they're doing occlusal guards. Typically, the patient is grinding their teeth, they're breaking teeth, things like that.
Oh, I lost your audio there somehow.
Oh, sorry about that. Sorry.
That's okay. There we go.
Is it back now?
Yep, we're back.
Okay. So the occlusal guard is addressing the damage that exists, in that, it's trying to prevent further damage from happening, but it's not dealing with what's actually causing that damage to occur. Okay. And so if you start to look there, quite often it is a dysfunction, a malalignment with the mandible to the skull. And the mandible is now deflecting, it's retruded, it's not in the proper position. And so the body is now trying to get it there, and that is the source of the grinding that's going on. Mm-hmm. So if we go to then actually, instead of treating symptoms, actually treating the disease that's going on, that's when you would be looking to put somebody into a TMD program with an orthotic to actually realign things in a physiologically appropriate way for their body. Mm-hmm. And so why would you want to do it? Because you're actually getting to the source. If you think about it, the first dentist I'd ever worked with TMD, he said something to me that just stuck with me. If you're not addressing the alignment that's going on, then when you do something like a crown, what are you restoring that crown to? You're restoring it to a bite that's already misaligned. So you're just reinforcing that. So if you're going to do restorative dentistry, don't you want to restore it to something that's optimal for that patient, which is going to serve them over their lifetime, versus something that, that problem will likely show up at some point in the future.
Right.
So there's a lot of clinical reasons to do that, and certainly ethical reasons, and especially if you have somebody who's already suffering symptoms. How to implement it in the practice is to understand that there's some questions beyond what you're already asking the patient, especially if you're looking at your night guard patients. Okay, because a lot of times, we're seeing grinding, we're seeing fractures. Okay, night guards. But if we follow that up with a few more questions when you're seeing those sorts of symptoms, and asking questions like, do you ever have ringing in your ears? Do you ever experience vertigo? Do you have congestion in your ears without any infection or cold or anything like that present? There's about a half a dozen questions that you can ask the patient, and all of a sudden it's pointing you to, this is more than just a grinding problem. There is actually a misalignment which is causing those other symptoms. In fact, we just talked with a doctor a few days ago and gave him those half a dozen questions to answer. And he literally just texted us a couple hours ago and said, I did that, and yesterday I identified 3 patients that had those symptoms going on. It's very prevalent, but we just don't know to ask the questions and be able to connect the dots.
Yeah, that's good. It fits perfectly with the approach of truth behind dentistry, right? I love where we can get to not so recognized factors or causation beneath symptoms, right? Because that's really where the truth behind dentistry would lie. In one aspect of that focus is what's really behind this, what's causing this, what are some other things that we should be addressing that we're not maybe equipped, prepared to address on a regular basis, hasn't been part of our training, maybe to deliver in those areas. So I love conversations that can bring out other key factors, underlying issues, ways that we can have even more of a unique, compelling contribution to patients by virtue. It often does require a bit of extra education, right, to connect dots, but that I think it makes sense to patients when you can give them those dot connecting elements for them to go, oh, I wondered what was behind that or what was causing that. Like, it didn't just happen. There was a reason for that happening, right? So yeah. I like that. I like the approach. So what else, as we kind of head into the latter part of our conversation here, what are any other factors that maybe show up as barriers for doctors, but reasons for not moving in this direction? What would you say?
The most common one is it's complicated. And because there's different schools out there that will teach different modalities, and a lot of times there's you need to buy this equipment and that equipment and instrumentation and all of this, and it becomes incredibly complicated, and that is the biggest barrier that I see, is just a fear of that Pandora's box that I talk about. Not so much that I can't help the patient, but how complicated is it going to be to help the patient? Right. And that's that's one of the things that really excited me the first time I took Dr. Kasab's course, because I took it with a client of mine. And so I was there as a student with a clinical background, and I was there with other doctors. And what was so phenomenal was it really challenged the doctors' beliefs that they had about TMD, because it was so interesting to watch as a dentist,
Right.
that they were like, yeah, but this, and yeah, but that. And Dr. Kassab was able to work them through all of their concerns and objections. It was so hard for them to digest that it's not that complicated. Everything that you understood about it and learned about it and heard about it has it very complex. But as those questions are brought up and those concerns are brought up, and she's able to really handle that and show you how it's not complex, there's a moment where all of a sudden it's like you watch their hair get blown back and they're like, oh, really? and it's so exciting because I've worked with doctors, and when they identify, just like this doctor did, those first patients, and then they start to say, okay, well, let's do step one here, and they do step one, and it confirms the patient's like, yes, boy, that feels so much better.
Mm-hmm.
Then you're on the right track. It's kind of like when you're chasing, is this an endodontic problem or not? And you're trying to, you're going through percussion tests, and you're doing several different things to confirm every step along the way that, yes, this is what's going on. She has those in place. And so it was just remarkable to be present and witness these doctors just throwing all their objections, as they should.
Right.
You don't want to just accept blindly. You want to challenge, because
Yeah.
you're scientists.
Right.
And they did that. They did what was appropriate and challenged it, and had that aha moment of, oh my gosh, this is something I can actually do. And now they're out there making a difference for patients that, are suffering and don't know to even talk to their dentist about what they're dealing with.
Yeah. Well, that's great. And obviously you having that experience brought you into obviously a level of interest that you are now investing a good part of your life business journey in this direction. So for those who are watching, to say, well, you've whet my appetite and been compelling in terms of what you've been sharing. If they want to know more, what would be the best way for doctors to take a first step to know more about what you're doing?
A great first step is that we have a completely free study club every Friday at noon Eastern, where doctors can bring cases. Obviously, we have a discussion topic that we're talking about that day, but doctors can submit their cases, and we will review cases with them. Dr. Kassab will review these cases with them. Send the Panorex, send us whatever you have for information, because as you start to work through it, it starts to make sense to you. And then it may make sense to go through our level 1 training, which will take you to the point where you're identifying it, you're able to get patients out of pain, and get them to really a new life in so many ways. And then from there, decide, do you want to go into the higher level restorative aspects of TMD care, and things like that. But at the very least, be able to identify it quickly, like in a hygiene exam, and help your patients get out of pain quickly. That it's just remarkable, the difference it makes, because nobody's more motivated to say yes to care than somebody who's in pain.
Yeah, absolutely. So what are the contact details then to find out about the study club then?
Yeah, absolutely. You can go to our website. It's tmdandsleepsolutions.com, and the information is right on our website to be able to register to get into the study club, and course information, and of course our email, and you can contact us. Our phone numbers, all of that is right there on TMD, and is spelled right out, AND, TMD and sleepsolutions.com.
Okay, awesome. Wonderful.
Yeah.
I learned some new things
you.
in the process today, so I'm trusting that everybody else did as well. And I'm expecting there will be people that are listening to us that will say, yeah, I want to know more. So hopefully they will follow up and reach out and check out the study club. So yeah.
Great. I'm looking forward to it.
Yeah, well, I appreciate your time, Liz. We had to work a little bit to get our time figured out to do this, but it was well worth it. And I appreciate you and the work that you're doing and the passion that you're bringing to the topic too. I think that means a lot. So thank you.
Well, thank you. Thank you. Clinical people want to take care of patients. And for me, being a coach, I also want to take care of all the people that take care of those patients. So,
Yeah.
that's what it's all about.
Sounds like a perfect marriage.
Yes, for me anyhow.
Yeah. Well, so thank you to everyone listening. This is Matthew Norton with People Plus Purpose and the host of Truth Behind Dentistry podcast. I've been with Liz Lord, the president and COO of TMD and Sleep Solutions, and I hope you will reach out and connect with her. And I look forward to seeing you on the next episode. Thank you.